Hi, my name is Dr. Maria Van Kerko from the World Health Organization. Welcome to this course on emerging respiratory viruses, including the SARS-CoV-2 virus, the virus that causes COVID-19. The overall learning objective of this course is to describe emerging respiratory viruses and why they are a threat to human health. By the end of this unit, you will be able to describe how viruses emerge, what coronaviruses are, who is most at risk from coronavirus infection, and how to protect yourself. Here we provide an overview of the timeline of some emerging viruses. Viruses continue to emerge and pose challenges to public health. Some examples are shown in this figure on the right. The first is in 2002 with severe acute respiratory syndrome coronavirus, or SARS-CoV. In 2009, the H1N1 influenza pandemic emerged. In 2012, the Middle East respiratory syndrome coronavirus emerged in Saudi Arabia. And in 2019, the first cases of coronavirus disease, or COVID-19, were detected in China. So how do new viruses emerge? Human health, animal health, and the ecosystems in which we live are linked. It is estimated that between 70 and 80% of emerging and re-emerging infectious diseases come from animals. That is, they are known to be of zoonotic origin. This means that these pathogens, these viruses, can be transmitted between animals and humans. Now, there are a number of reasons why we may be seeing an increase in the risk of emergence of such pathogens, having to do with population growth, climate change, increasing urbanization, and international travel and migration. But what is a coronavirus? Corona means crown in Latin, and coronaviruses are a large family of viruses that are known to cause illnesses ranging from the common cold to more severe diseases such as Middle East respiratory syndrome, or MERS, and severe acute respiratory syndrome, or SARS. The new or novel coronavirus that is now named severe acute respiratory syndrome coronavirus 2, or SARS-CoV-2. This is the virus that causes the disease, which we call COVID-19. Where do coronaviruses come from? Coronaviruses cause disease in a wide range of animal species. SARS-CoV-2 was transmitted from civet cats to humans in China in 2002, and MERS coronavirus was transmitted from dromedary camels to humans in Saudi Arabia beginning in 2012. There are several known other coronaviruses which are circulating in animals that have not yet infected humans. A spillover event is when a virus that is circulating in animals is transmitted to humans. On this slide, we present an overview of the current epidemiological situation as of early October 2020. What we'd like to highlight here are just some key early actions that were taken by WHO to alert the world of this cluster of unknown etiology that was first detected in Wuhan, China on the 31st of December 2019. Just to highlight a couple of examples, on the 10th and the 11th of January, WHO issued its first technical package of guidance, which is currently online at who.int. On the 30th of January, WHO declared a public health emergency of international concern, the highest level of alert under the international health regulations. And a few days later, we issued our first strategic preparedness and response plan to deal with COVID-19. All of these materials are available on who.int. On the 11th, WHO described the situation as a pandemic. But what is COVID-19? COVID-19 is the disease that is caused by this recently discovered coronavirus, SARS-CoV-2. The most common symptoms of COVID-19 are fever, dry cough, and shortness of breath. There are other symptoms that are less common and may affect some patients. These include aches and pains, nasal congestion, headache, conjunctivitis, sore throat, gastrointestinal symptoms like diarrhea or nausea, a loss of taste or smell, or discoloration of the fingers or toes. These symptoms are usually mild and begin gradually. Among individuals with symptoms, most people, about 80%, will recover from disease without needing hospitalization treatment. But about 20% of people with COVID-19 will develop serious and severe disease, including difficulty breathing. Older people, those with underlying medical conditions like high blood pressure, heart and lung problems, diabetes, or cancer are at a higher risk of developing severe disease. Now, how does this virus spread? When we think of transmission of the SARS-CoV-2 virus, we need to think of a combination of factors: how, when, and where the virus spreads. Take a moment to look at this video on how this virus spreads between people, and we'll come back to the course in a moment.
Hello and welcome to Science in 5. I'm Vismita Gupta-Smith and this is WHO's Conversations in Science. This is the series where WHO experts will explain the science related to COVID-19 so you can protect yourself and your loved ones. Welcome, Maria.
Hi, Vismita. Thanks for having me.
So tell us how this virus infects the human body.
What is really important that we understand about transmission is how this virus transmits, meaning how does this virus move from one individual to another, when the virus transmits, meaning when does somebody who is infected with this virus transmit to others, and where is transmission taking place? What is the setting in which the virus is spreading? So what we know about how it transmits. So this is a respiratory pathogen, a respiratory virus, and most people who are infected with the SARS-CoV-2 virus tend to have these respiratory symptoms. And the virus can be spread by droplets, or these little particles of liquid that come out of your nose and your mouth when you talk, when you cough, when you sing, when you're in close proximity to somebody else. These particles, these droplets, can be various sizes. They could be larger or they could be smaller. The larger droplets tend to drop more quickly and the smaller droplets can remain suspended in the air for a little bit longer. But this virus transmits when you're in close contact with somebody else, and when an infected person gets those droplets into somebody else's eyes, nose, or mouth. The other way in which this virus can transmit is through contaminated surfaces. So if somebody is infected and they have the virus in these droplets, it can fall onto different surfaces. And if someone touches those surfaces and then touches their eyes, nose, and mouth, they can infect themselves if they haven't washed their hands. But the good news is that if you wash your hands, if you keep physically distanced from people, you could prevent that from happening.
So Maria, tell us now about when and where, in which settings this virus is transmitting.
Now, when a virus transmits from an infected person to another is really important. What we know about this virus is that people can transmit the virus when they don't have symptoms. So they can be infected with the virus and not yet have developed symptoms. Or they can pass the virus when they do have symptoms. It appears that most people are most infectious at or around the time that they develop symptoms, which includes a few days before they actually get sick or actually start to feel unwell. And then where the virus transmits. So the setting in which the virus spreads is a combination of the intensity of the exposure somebody has, the duration of exposure they may have to an infected individual, and then the location of where that's taking place. So for example, we know that in crowded settings, when people spend are in close proximity to one another, they spend long periods of time, they're in a room that's crowded, may not have good ventilation, that is a good example of where transmission can take place readily, helping us to look at each of those changes to determine which ones are really important as we understand how the virus behaves.
There you have it. That was Dr. Maria Van Kerkhove explaining the science of how SARS-CoV-2 virus infects our body and how we react to this virus. Remember, we'll keep bringing you the science as we learn more. Until then, stay safe and stick with science.
Some people are at a higher risk of infection with the SARS-CoV-2 virus, the virus that causes COVID-19. These include family members or healthcare workers who are caring for someone with COVID-19. We also know that the virus can spread more easily in indoor settings where there are crowded situations, where people are in close contact with one another for long periods of time. How can I protect myself from infection? There are so many ways in which you could prevent yourself from getting infected with the SARS-CoV-2 virus. First, clean your hands regularly with soap and water or use an alcohol-based hand rub. Second, practice respiratory etiquette. Cover your mouth and your nose with either a tissue or a sleeve or flexed elbow when coughing or sneezing. Practice physical distancing. Keep at least 1 meter apart from other people when outside of the home. Avoid the 3 C's. There are certain places where COVID-19 spreads more easily. These are crowded places with many people nearby, close contact settings, especially where people have close-range conversations, and confined and enclosed spaces with poor ventilation. Make sure you open a window to increase the amount of fresh air. If you are unwell, stay home and contact your medical provider. Avoid unprotected close contact with anyone who has cold or flu-like symptoms, and seek medical care if you have a fever, a cough, or difficulty breathing. This is the end of the first unit. For more information, you can go to the COVID-19 website on who.int, shown here on the screen. Thank you for your attention.